Man, I would love to discuss. We all have teenage boys that are in athletics, so I think this is a very good topic to discuss.
Yeah, so let's tee it up. All I know about it, I didn't dive deep into the story, but LeBron's son, Bronny, had a cardiac arrest while playing basketball. Was he playing at the time?
He's at practice, I think.
He's at practice.
Yeah.
And the limited information I have on this topic is I did watch a Real Sports with Bryant Gumbel, and they really went into deep about the number of cardiac arrests that athletes are having. A lot of it, athletes are outside and overexhausted, and the deaths are just astonishing, in the thousands per year. Forgive me for not having the number in front of me, but thousands per year, athletes dying in practice. So let's go to Dr. Batiste, because from a layman's perspective, it's double shocking because these are athletes. They seem healthy.
Yeah.
What's happening?
Well, I mean, like you said, this is nothing new, right? So we've known it all the way back to the days of Pete Maravich, Hank Gathers, Flo Hyman, right? Reggie Lewis. All these people died of sudden death. And so when we look at it, it's pretty simple. So we're not as technical as Dr. Q, right? We don't do all the dibbling and dabbling. We're either plumbers, we are electricians, or we're body and fender guys. So you look at the structural, it can be a structural issue, it can be an electrical issue, or it can be something on the outside that's causing a problem. So that's usually the cause of a cardiac arrest. But in our athletes, like you said, these are our superheroes. And so the deal is that in order for them to do superpower things, fly through the air and dribble, do all that stuff, what has to happen? Well, their hearts have to shift. And they become shapeshifters. Their hearts shift so that way they can perform more and deliver blood throughout the body. And so when their heart takes on that new configuration, it actually mimics something we call pathology, a pathological issue in terms of the heart can dilate, it can thicken, it can have all these things that happen to it that now may possibly predispose them towards some events. So we just never know. So you start exploring. And you look at the case of DeMar Hamlin, you have commotio cordis where you just get hit in the chest.
Right,
and to be honest,
I forgot about him.
Soccer players and baseball players and cricket players than it is anywhere else. But here's the crazy part. Most of the sudden cardiac arrests happen in basketball players, more in blacks than in whites, more in men than in women, is what we see. See that what happens too as well. It's crazy.
So let me see if I can repeat what you just said. The way it's in my brain. You're asking a normal Honda Accord to do a sports car activity, and it responds by changing itself and adding rims or whatever, and trying to add an 8-cylinder motor, but it's still a Honda Accord.
That's right.
And at some point, it's going to reveal its colors and break down.
Yeah. I mean, it absolutely can. It can break down.
And no offense to the Accords. I drove an Accord for years. No offense to the Accords.
Come on. Listen, I still have my stick shift. I bought the stick shift just to teach them.
So the heart is just not used to it.
Yeah, and so here's the crazy part, right? So everyone's born and they're shaped differently. So you can have arteries that come off, and some of the arteries can take a different course where they fall between a different structure. So when you start to exercise, it compresses the artery and can lead to an issue. That's actually what happened to Pete Maravich. He died because of what we call an anomalous coronary artery. His artery took off from a different direction that led to his demise, and so you just never know. Now, Hank Gathers died because his heart was too thick. And it was so thick, it's something we call hypertrophic cardiomyopathy that led to him having an issue.
When you say the heart was too thick, does that mean the heart itself was too big? The heart walls were too thick? What was too thick?
The heart walls are too thick. So the heart is like a muscle. So, I mean, when you get in the gym like me and you start doing the curls and your biceps get big, you get your guns, the 21-inch, you get your guns on, that muscle is going to respond to the weights, right? And so the same thing, when your blood pressure typically can thicken the heart, but sometimes it just grows abnormally. Sometimes you have people who are just big naturally. They're like Baby Huey, right? They're just big. They're big all over. And so some individuals, the heart muscle is too thick And that thickness, it predisposes towards irregular heartbeats that can then take off, and you get this short circuiting that happens, and that leads to a demise of ventricular tachycardia, ventricular fibrillation, and obviously cardiac arrest.
Let me ask you a question. So, if you were an athletic director at a D1 school, how would you recommend their screening of the athletes? Like, would you recommend, like, I actually heard today someone say that there was an AD that recommended, or the team physician recommended an echocardiogram on every athlete that was playing, just to look at the structure of the heart and to look at the function. Is that overkill, or what are your thoughts on that? Like, how can you predict that if you can?
We don't know. That's the crazy part. So you can do an EKG, but just like I told you, the heart will normally transform. And when the heart transforms, you're going to see it look thicker or bigger, but do we know if that's something pathologic that's going to lead to demise? So you might overcall. So whether or not we should be doing MRIs on everyone, whether or not we should be doing echoes on everyone, for sure you do EKG, but you expect to see an abnormality. And here's the crazy part, right? So if you're of African descent, if you're Latino, you're likely to have certain characteristic features on your EKG, the squiggly lines. We all have seen that, right? And so it's something we call early repolarization, which means the bottom part of that tracing may look abnormal. And so you're not sure if someone's having a heart attack or what's going on if you're of African descent. That's how mine looks, actually. I found that out inside training.
So I've always, people always say about heart disease, heart attacks, all the heart complications, it's a silent killer. And it feels like, and Q, great question, because it feels like we're asking these ADs and coaches and the people on the sidelines at practice to solve for something that there are no external signs. Can we arm them with anything? It feels like all we can say is shorten your practices, watch the temperature, hydrate. Other than that, you gotta stop practice at a certain number of hours because we just don't know what's going on with these hearts.
Well, I mean,
add a defibrillator too, I would add.
Add a defibrillator.
Yes.
Oh, great! Yeah, you saw the real sports episode as well.
No, well, you know what? Those emergency action teams are so important. I mean, that's the part that's life-saving, is the fact when you have individuals, we can all check CPR, learn CPR. We all can sit in and try to do, we can all learn AEDs as well, which are extremely important.
Yeah. So, an AED, if delivered at the right time, I know you can save a life, but can you prevent all, what's the word I'm looking for? Can you get them back to normal?
The faster you use it, the higher the likelihood you will.
Okay.
Right. So
all right.
think of it like this. Imagine if your eye starts twitching, right? It's just twitching. That muscle's firing like extremely fast, but your eye isn't opening and closing. It's just going really fast like that. It's just tremoring. That's what happens inside your heart. Your heart ceases to kind of boom, 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 and it's just kind of twitching. So nothing is circulating. That means you're not getting perfusion to your brain or your organs, and the longer that happens, the less likely you're going to recover from that. The sooner you give compressions, that's why we talk about chest-only compressions. First thing, why? Because you're pumping the blood. When you compress on that chest, you're actually squeezing the heart to squeeze the blood out of it in that moment to deliver it. And when you shock the heart, you're basically jump-starting like those old school VW bugs. I don't know if y'all are too young to remember that, right?
I remember that.
They'd stop and you just start pushing them down, and they would jump-start. That's what shocking the heart is. You kind of jump-start it in that moment and get it back.
Yeah, that's good.
So what you're telling us is that there's really no way to predict who's going to have a problem out there on the field or on the court. Which is a little unsettling for a parent of an athlete, of a D1 athlete. So I guess we're asking our doctors, our EMT people on the side to be extra prepared just in case something happens, because there's really no way to preempt or predict, right?
Well, I mean, I don't want to go that far. So, obviously, an excellent history and physical exam. We're going to do an EKG and look for certain abnormalities that will point us in the direction that there could be a problem. Then you're going to then lead to different tests. You mentioned the echo, which is an ultrasound like you do for babies, to look at the heart structure. That then may lead to an MRI. And you're trying to put all those pieces together that will give you a sense of, is this individual high risk or not? What I'm telling you is that it's not a precise science. And it would make sense, hey, just give everyone an MRI and go from there. But, that's the problem with America, right? We do every test on the face of the earth, and we don't really have better outcomes. And so we see that. And so I don't know. The way I tell patients is like this. Those old school cars had timing belts on it. And it was like you pay a grip of money to get that timing belt checked or replaced, because it meant you had to take the engine apart. Going and doing all these tests to check the timing belt when you may not get return on investment doesn't really make sense. You say, well, this is a life. But what ends up happening is it may lead to other tests that then cause complications, or you may keep someone from something, becoming Michael Jordan, become LeBron James, the greatest, right? And so in that moment, when they could have gone on to do great things, but you kept them from it.
Let me ask you a question. If you are LeBron James and your son just had a cardiac arrest, are you letting him play again?
I'd have to know why. So okay. So as you brought up the fact of like dehydration and heat stroke, that's a separate thing from, I mean, you didn't say that directly, but you implied basically by over-exercising in the heat and everything like that. That's what that implies to me. And that's a different pathology or sequence of things than from an underlying structural issue. If his was from something like that, absolutely. If there was a question, so my understanding was Hank Gathers, I was too young at that point, they knew there was a major problem. But he said, I want to go in and play.
I remember that,
problem.
yes.
And he went back in before he ended up passing away. And so if we identified that there was a problem after I felt confident that there was nothing that we could identify that was high risk, then I would, right? But with that being said, man, I'm a conservative dude when it comes to my kids, right? I'm not even going to lie. I'm not like that dude that's like, oh, go on, get back out there. I'm like, this could happen, that could happen. So.
Yeah, that's tough because we all know LeBron is waiting to play with Bronny, and he's holding out, for that option. So that's a tough decision he has to make.
Yeah, LeBron could be that classic push parent, But they're out there.
Yeah.
Ignore the signs. We got to make a superstar out of you. I mean, we see those parents all the time.
Yeah.
But,
I don't know if it's worth it.
Yeah. I mean, the impression I get from him, from just the media, is that dude is all about his kids. And I would probably think he would put that over the short-term success of being in the league and playing with them for doing something else.
Yeah, let's hope so, and let's leave it there. That's thank you. Glad we had Dr. Batiste here for that conversation.
Absolutely. Thank you.